In this topic, I'm going to talk about the gaps. We don't tend to think of childbirth in terms of gaps, skills, successes. So what do I mean by a gap when almost everything, it turns out, is a gap? Low risk versus high risk. How did you bridge that gap? Here are some other gaps: hospital versus home, doctor versus midwife, trust birth versus being fearful, instinctive birth versus being skilled, women know how to birth versus it just happens one way or another, for a father or man to be a coach versus being a support person, interventions versus no interventions, vaginal birth versus surgical birth, pain as a word used versus rushes or waves. What else would you put on this list? What about when we use the word, what is a natural birth or what is a normal birth? What do those words mean? Or what does physiological mean when it comes to birth? It can mean spontaneous, but can it mean a bad outcome or spontaneously have something that you don't want? But these are the gaps, this understanding of gaps. And as you make that list, you'll find that you're dealing with sort of these individual components. Under this concept that when you're pregnant, you should become skilled, this is dealing with universal. I want to tie these gaps to the three elements in birth that every culture throughout time and place are concerned about. One is that you have an alive mother and baby. People don't even go as far as having a healthy mother and baby because there are so many variables to that. People just want the mother to be alive and the baby to be alive. And the second one, nobody wants a woman to suffer. And the third is we want women to recover from birth. That's an area that's still fairly taboo to talk about. And we want the baby to be well after the birth. Not all babies are well after the birth. When we're looking at these things, we want to look at them from the viewpoint of medical care, conventional medical care, natural birth, and traditional wellness, because those are basically three different systems. Modern medical care varies to some degree, country to country. Traditional health care varies greatly between culture and culture and what's available in that local area. And the natural birth movement actually is quite a global movement. So what we know is that the modern medical system, they do assessments, monitoring, procedures. Those things, the assessments, the monitoring and procedures, have had both a positive and negative impact on both mothers and babies. We acknowledge that. The natural birth movement, it's not partial to assessments, monitoring procedures that they believe are interventions and unnecessary and imposed on people. Diet, probably one of the big ones, making a birth plan, making choices, exercising, trying to reduce your anxiety or fears. For traditional cultures, it's all about do's and don'ts. So when we're thinking about gaps in terms of health and wellness, what we're asking you to do in advocating this concept is to encourage the families who take on this concept that it's beneficial in common sense to become skilled in their pregnancy and use those skills to birth, is that we're no longer talking about an either or. We're no longer talking about hospital versus home birth, natural versus medical birth. We're talking about both and. In other words, you can use skills and have a cesarean. You can both use skills in a vaginal birth that has risks. You have a change perceptually between these schools of thought to having this bigger ability to reach out to those 100% of pregnant women who are going to give birth. Does one thing have to solve all these big issues? No, but without skills, we're not solving any of them. But we have to test all of this out in a bigger sphere. And ICPA has a large number of members. We're asking you for 6 months to keep it simple, stupid. Just say to all your pregnant clients, look, we want to enliven the childbirth trend or have a new childbirth trend. We want to couple you learning skills with choices that you have or don't have or that may change. And here's a handout of the skills-based methods we know about at the time. That can grow if there are more skills-based methods developed or known. Why not? People should have choices. And then to just simply say, let me know know what you've chosen, and then each appointment, let me know what skills you've learned. And then after the birth, just informally tell me, how did they work? How didn't they work? What other skills would you have liked? That way we can gather information and data, and that's so important. The other thing that I want to emphasize is men and fathers. When I gave birth in 1970, both Lamaze and Bradley were very focused on fathers being coaches. And then in the 80s, the message that came from the natural birth movement was that women shouldn't be told what to do by men, and that men should just support women's choices. And sometimes they were told to protect the sacred space of labor. We want you to know that from our viewpoint as Birthing Better, that the concept and skills were developed equally by fathers and mothers, because we were families and we wanted to grow together as families. And we wanted this amazing thing called a continuity of skilled self, so that we would all have skills to evolve in pregnancy, in birth preparation, and then working through the activity of birthing our baby. And by doing that, once our baby was born, we felt much more confident and much more capable as human beings and as families. So what I want you to do as I close this video is a simple visualization. Think about the gaps: a live mother and baby, suffering, and birth recovery or issues that women or babies had. Think about that. And then think about multiple millions of women doing this activity without skills. And then imagine those same multiple millions of women and men or others doing them with skills. Can you see how growing a self-learning, skilled birthing population can add to and enrich these elements that are universal about birth?